Good afternoon, everybody. Thank you all for joining us for this important panel discussion on domestic violence and racism. I'm Bree, Director of Programs for the Women's Center and Shelter of Greater Pittsburgh. I would first like to thank our longtime supporters, Eckert Siemens, for sponsoring today's discussion, and our DV Awareness Month kickoff event earlier this month. I'd also like to thank the YWCA of Greater Pittsburgh for their partnership during October and throughout the year. We are proud to be working together to combat racism and violence in our community. As a part of this year's DV Awareness Month initiatives and our collective agency's commitment to equity and inclusion, we are highlighting local Black-owned businesses as community sponsors on this year's DV Awareness Month website, which will be placed in the chat. We'd like to thank these 13 incredible businesses for their partnership throughout the month. Please check them out on the website. Now, it's my pleasure to introduce our moderator, Dr. Angela Reynolds, who is the CEO of the YWCA of Greater Pittsburgh. Thank you, Angela, for leading our conversation today.
Thank you, Bree, and thank you everyone for joining us. So October is Domestic Violence Awareness Month. YWCA Greater Pittsburgh is proud to partner with Women's Center and Shelter, not only this month, but as was mentioned, we've been partnering for years actually, as we work together to address intimate partner, gender-based violence in our communities. So in order to think about why we're here today and to really point to our purpose, I think it's important for us to talk about our mission. So collectively, Women's Center and Shelter and YWCA Greater Pittsburgh, but then also our vision. And I want to actually read to you Women's Center and Shelter's DNA statement. And I love this. It says, "We are advocates grounded in fostering a community of safety, healing, and empowerment for anyone affected by domestic violence. YWCA Greater Pittsburgh aims to eliminate racism and empower women. And we do that by not only advocating for systems change and also for legislative priorities that support women and particularly women of color, but we also address racial disparities that are existing because of these systemic structures." So the two of our organizations coming together today and this month around domestic violence should let you know that we need to continue to advocate for systems change. We need to continue to do that. But at the same time, we also need to be able to continue to have a healthy environment for those who are survivors of intimate partner violence. We echo Women's Center and Shelter's vision that we exist to end domestic violence and create safe spaces for help, healing, and for hope. So just a couple of things before we get to our panel is that as we think about this vision and our desire for a day when we're not here still talking about intimate partner violence because it's been eradicated, we're not still talking about about racism because that has been eradicated, we need to recognize that for the here and now, these are still issues. And I want to point to a few statistics, but understand that any statistics that you hear come from me or that you hear come from anybody else on this panel are likely underestimating the incidences of domestic violence. So about 1 in 4, so 25% of the population experience domestic violence. Research suggests that somewhere maybe between 3% and 15% actually report it. So there are many people who are surviving in silence. As we think about that and what that means for populations, particularly communities of color, that's why we're here today to talk about this intersection. So why not just address domestic violence more broadly? Why this focus on intersectionality? And we could talk about race, we could talk about disability, we could talk about other intersections as well. All races and all genders and all gender identities experience domestic violence. However, there are higher rates for people of color and for those who identify as multiracial. People who identify as gay, lesbian, or bisexual are at a greater risk for sexual or other violence from an intimate partner. Bisexual women are nearly twice as likely to experience intimate partner violence than heterosexual women. And then also understanding that barriers to accessing safe spaces for both of our agencies are working to achieve, those barriers can be greater for communities of color. Professionally, I have addressed the challenges, for example, with the nuisance ordinances and the harm that that can have on survivors who are already prone to being vulnerable, but also saying, so now you're going to potentially face eviction. And not only that, potential criminalization, and that this can happen in communities where these eviction rates are already high. Quality housing is hard to find, and communities that are being over-policed because of racist systems and structures. So that as a backdrop of today is why we are focused on this intersection, and we have this wonderful esteemed group of panelists that are going to help us through this process for about the next hour or so. So I'd like to introduce our panelists for this afternoon and thank them also for being here. Dr. Judy Chang is a board certified obstetrician gynecologist and an associate professor in the Department of Obstetrics, sorry about that, Gynecology and Reproductive Sciences and General Internal Medicine at the University of Pittsburgh. Welcome, Dr. Chang. Dr. Toya Jones is the Program Director for Undergraduate Social Work and Assistant Professor in the School of Social Work at the University of Pittsburgh. Welcome, Dr. Jones. And Dr. Maya Ragavan is an Assistant Professor of Pediatrics in the Division of General Academic Pediatrics at the University of Pittsburgh. Welcome, Dr. Ragavan. And just wanted to remind you that you can find out more about our panelists, but you can check out their bios. The information will be in the chat. It's also on the website, and that you can ask questions. So put those in. We'll make sure that when there's time for Q&A, that we'll be able to address as many questions as possible. And we'll let you know closer to that time when you can start to put those in. But also feel free to use the chat to connect and also to put in thoughts. I mean, we are, so I'm saying I'm outing myself. I am a survivor. And so understanding that also there's a community of us and that we are stronger together, but I'm also able to be the moderator because I had to think about it. My staff knows that. I'm able to be the moderator today because of the support that I received from Women's Center and Shelter. So for each of our panelists, I want to start with a question for all of you. So could you please tell us about your involvement in domestic violence work? How did you get started? What motivated you? And so we'll start with Dr. Chang, and then we'll move on to Dr. Jones and then Dr. Ragavan.
Okay, thank you so very much, Angela. Thank you for being here, everybody, and for sponsoring all of this. My involvement in the field of intimate partner violence actually emerged from my undergraduate identity seeking, I think, in terms of being a liberal arts major that focused a lot on women's studies. And so in my burgeoning identity growth as a feminist, I think I was trying to find ways of being able to support women in their empowerment. And so I'd always wanted to work with advocacy and service for those who are experiencing intimate partner violence. I think I was intimidated back in the undergraduate sort of years because of the intense training that volunteers really appropriately need to go through. And so didn't quite do it then, but during medical school, I had the opportunity during my fourth year, because our psychiatry clerkship was long and yet very loosely structured. So I had a lot of free time. And at that same time in Houston, there was a huge need. We were hearing advertisements saying that there was a need for volunteers at the Houston Area Women's Center. And so because there's that correlation, I was able to skip out on some of the things with the clerkship to go and get my volunteer training with the Houston Area Women's Center. And what was really amazing for me was that I learned so much. To a certain extent, I actually had to unlearn some of the things I was taught in medical school, quite honestly, especially with regard to the way that we spoke with clients. Like the way that we had been taught to speak to patients had been very, looking for the differential diagnosis, trying to kind of zoom in on, let me try to find the diagnosis, and then I'll give you your answer and I'll give you your treatment. And will be good. And of course, I had to be remediated, I think, when I was going through the volunteer training, because that wasn't the approach. The approach focused on empowerment. And so it had me step back to make sure that what I was doing was fostering autonomy, fostering sort of reminding sort of clients that they had that power within, and helping to lift that up instead of telling them what to do. Because of the impact of that training and that experience, that became a huge focus of my career development, both as a women's healthcare provider in terms of OBGYN, and then as a clinician researcher. So that has remained a central sort of component of my professional identity. And I've been really, really fortunate to work with amazing partners who've continued to illuminate me, like the Women's Center and Shelter of Greater Pittsburgh and other advocates. Thank you so much.
Thank you, Dr. Chang. Dr. Jones.
Yeah, thank you. Dr. Chang, our stories parallel one another. So when you were saying that, I was, me too, over here. My journey started as a bachelor's student. I was in an internship, and my undergrad is in psychology. So I was in an internship that just wasn't reaching the mark. And I'm one of those, tenacious people. I need to get my education. So I applied to be a volunteer at a domestic violence sexual assault shelter. And I had no idea. I didn't study trauma. I didn't know about DV or anything like that. I just kind of knew I wanted to help people. Nobody ever believes me when I say I knew I wanted to be a therapist at 11 years old. People laugh. You didn't know? No, I really did know for some reason. And so I knew that was the track I wanted to go, but I didn't know that I really would find such a love with working with women and survivors. I had no idea. And so I went in there, and yes, Dr. Chang, that is some intense training. I remember as a bachelor student feeling like, what did I get myself into? This is really intense, but it was so thorough that I can say 20 years later, I still use a lot of those skills and still remember a lot of the things that I learned. And so from that point on, I worked at the Center for Victims as a legal advocate and therapist, and I just did a lot of different things there. And of course, serviced a lot of intimate partner violence survivors. And I just really loved working with the women in the shelter when I was back in my bachelor time. And I knew, they had me, they hooked me. And so I was going to continue to do this really important work. And also as a brown face, as, identify as Black, I thought, well, there wasn't, in that particular shelter, there were no brown faces. And I thought, oh, I have to be a brown face so that, my brown sisters can see me and know that that's an invitation to seek assistance and help, and that it's okay to do so. So that's my journey. And that was quite interesting that, that Dr. Chang and I had similar beginnings. So thank you.
Thank you, Dr. Jones. And now Dr. Ragavan.
Thank you. I'm just so honored to be here with Dr. Jones and Dr. Chang, who's a dear mentor of mine. So I feel so honored to be on this panel. So you know what? I had such a similar journey to both of you. I think, for me, my family is from India. I'm a second generation immigrant, and their domestic violence is deeply personal to me, as it is to so many, I think, of us who are in this movement based on our family's experience, our own experiences. My great aunt actually set up a network of domestic violence shelters in India. And so that's how I got introduced to this work, in addition to the sort of personal experiences of survivors in my family. And much like Dr. Jones and Dr. Chang, I was a volunteer domestic violence advocate. And I also worked at a South Asian specific IPV agency. I sort of realized that this is what I want to spend my life doing. This is an area I'm passionate about, is supporting survivors and their children, as a pediatrician. And part of, I think, very related to this talk, part of my work has focused on supporting immigrant survivors. And one of the things that I found very personally, which has been a deep sort of pain and complexity for me, is I have had many people who I think had probably good intentions ask me about the way women are treated in India and really vilifying Indian men. As describing Indian culture to be one that is rooted in misogyny and patriarchy. And it has been a deeply complex journey for me to be able to both agree with that and realize that that there's so much work for us to do, but then also really try to grapple with the fact that in so many cases, Black and brown men are vilified and made to sort of that there is a sort of difference between them, and feeling like I have needed to very much defend the Indian men in my life. And so that has been a journey that I have gone through, really trying to understand how can we think about supporting immigrant survivors from a sort of structural standpoint, and really think about the ways that immigrant survivors are cut off from resources due to racism and xenophobic, policies and practices. And so that is my journey. I am always, I am still, new in this journey. I think that this journey is one that, where we all continue to learn and grow and become better advocates. And so I'm here to also learn from all of you, in addition to share any of my own experiences.
Thank you, Dr. Ragavan. And thank you, all three of you, because you've also shown a picture of other areas of diversity and intersectionality. And so we could, think about nationality, we could think about issues of religion and various aspects as well. So as was noted earlier, again, all races, all ethnicities experience intimate partner violence. Let's just make sure that we're clear on that. However, women of multiple ethnicities, American Indian, Alaska Native women, experience the highest percentage of intimate partner victimization compared to other races, ethnicities, and sexes. So Dr. Chang, this question is for you. So your work has focused on women and intimate partner violence. Would you please explain, if you can, some of the reasons why we're seeing higher rates of domestic violence among women of color compared to white women?
Yeah, no, that's a great question. And honestly, I think that there's a lot of curiosity and uncertainty around that because, intimate partner violence requires people to be willing to disclose to us. We don't have a biomarker. We don't have some sort of computerized sort of test to sort of say, bing, okay, it's existing here. And one of the challenges then is reporting bias in terms of some of our studies. And so that's going to be always a challenge. And even sort of historically, we've seen some challenges with those who actually might be in higher socioeconomic status positions or in sort of privileged positions where they feel that even for an anonymous sort of study that loss of confidentiality may actually be risky for them, that they may not be willing to participate or not be willing to disclose. That being said, I think one of the things that is really alarming with regard to the disproportionate statistics that we see is that we see higher severity in individuals of color. We see higher homicides, honestly. So that may then generate the awareness when severity is higher, when the injuries and the type of violence may be higher. Definitely we're seeing more homicides. And it's difficult for me to truly understand sort of where all the factors are. There's probably multiple factors related to that, barriers to getting help, not necessarily helpful responses from certain existing resources like the law enforcement or other types of services. So those are some of the thoughts that I have with regard to it. And I think that there's also a little less attention placed on actually helping to address the issues in populations of color. Certainly, we've been hearing more information about those that have indigenous sort of heritage and sort of the high level of homicides, and yet very little exploration in terms of finding the sources and introducing the interventions.
And I hope we can come back to that thought later in the panel in terms of how do we start to address some of those barriers that are out. But I do want to say thank you, Dr. Chang, in your comments. You made it clear you're not blaming the victim, right? Because one could look at this question and say, well, there are higher incidences because of something innately with populations of color, and that's the blaming the victim. And rather than saying like, what are some other reasons why we're seeing higher incidences, not necessarily something innate to people. Also, thank you for pointing out the issues in terms of income, another intersectionality and position that is brought to the table. And now, Dr. Jones, I want to turn to you because as a trauma specialist, and you said you've wanted to be a therapist since you were 11 years old. That's fantastic, but that also means that you're intimately involved with people and their experiences and their trauma. So what can you tell us about the intersection of trauma that's caused by racism and the trauma caused by intimate partner violence?
Yes, I so appreciate this question because it's not asked enough, in my opinion. So thank you. Thank you for asking this. You know, Black women specifically are more reluctant to disclose domestic violence than other ethnicities. And it's for several different reasons. So sometimes I have my theories, and other times it's, you know, documented. And so one common reason I believe is a myth. The one common reason is it's in the culture, it's in the Black culture to not disclose domestic violence, when actually it's racial discrimination, it's racial multi-generational trauma. That's why, again, this is absolutely my theory and from what I've read, that, you know, we're not coming forward as Black women because of the racial trauma. Historically, we've been, you know, objectified. We've been looked at as we don't feel pain. We've been looked at as less than a human being. And so coming forward and saying, I've been abused by, a lot of times it's a Black partner. And so that's another reason why I think that Black women aren't coming forward as often, is because, you know, living in a country full of institutionalized racism is really going to stop you in the tracks of reporting, you know, your Black significant other. Because why? Well, we're protecting our Black men. We're protecting them from the court system. We're protecting them from police, because we all know, and I think we could all raise virtual and real hands to say, we all know that we're mistreated within the court system and within, you know, with police. I mean, George Floyd is just one huge incident out of, you know, many throughout the years. And so, you know, we're not quite over that traumatic history of our men being carried away and shackled and sold and mistreated. It's just in a different form. And so we're protecting our men. You know, the strong Black woman, yeah, I wear it pridefully, but also, you know, there's times when we can't take off the cloak. We're always strong and Black. And so what does that present? Well, that presents as we fight back, and that's actually very good. Well, no, it's not. It's a very toxic situation. And we know statistically that, you know, Black women in intimate partner violence situations end up getting killed more often. And so if we're not talking, that means that we're you know, surviving instead of thriving in these toxic relationships, instead of getting out and getting the help that we so desire. And so that strong Black woman is a weight, and also it's a crown. Also, just history with Black women and girls being sexualized. It's, you know, it's in the media, it's in people playing videos, but it's not just that. It's, if we watch closely, it's everywhere. It's permeated through our culture. And so going into the system and saying that I've been abused and I've been, violently, endured physical assault, a lot of times within the court system, we're mistreated. And so if I go into, the court system and, shout out to Women's Center and Shelter because they have so many services. I'm on their board, but I also really love the organization because they have a lot of services put in place where the woman is not going it alone. And so they have court advocates, they have therapists, they have all of these things. And the reason I'm saying this is because that will decrease racial discrimination. They have brown staff, they have lots of brown staff. I love that. And so being mistreated in the court system can be less of a fear. The other thing I want to talk about where that intersecting with DV and women of color is the judgment by family and the judgment by the community. So I know in the Black community, we have this word snitching, and we can have a whole nother talk, and I can talk about snitching and how much I detest that word. But if you are talking about, your significant other, and specifically a Black man, you are reporting them to the police, even family have a tendency to turn against you. And that within our culture or within our, racial discrimination is you don't ever open up your door and air your dirty laundry to anyone unless they are of the family. And that is something that it's in us for generation to generation. So, we're raised to keep what stays in the house. I mean, what's in the house, we keep it in the house. Well, what does that do? Well, that's conditioning our mind to keep these secrets that we don't need to keep, and it continues to have us in danger. And so because we don't want to be alienated or cast out by our community and our families, we keep silent. And what do? We keep silent and we get more abuse, and more abuse will lead to death. And that's a serious situation.
Thank you so much, Dr. Jones, for those comments. And I would say Dr. Jones and Dr. Chang both, also get to those questions that people ask sometimes. Why didn't you tell? Why didn't you say something earlier? Why didn't you leave? Right. And so understanding that there are complex situations that we're dealing with, but then also that trauma and the community context, family context, and historical context, and what that means. Dr. Ragavan, this next question is for you. And many of us are, dealing with the impact of COVID-19, and many of us, had to deal with, being in a house with our loved ones and what that meant. So your pre-pandemic research focused on intimate partner violence and gender equity, particularly within immigrant communities, and you pointed to that earlier in your comments. Then during the pandemic, you became a leader with the Pittsburgh Community Vaccine Collaborative, making sure that the concerns and needs of marginalized people were heard. And I did want to say thank you for that, because it's so important in terms of how it impacted our communities. But I'd like for you now to speak to what are some of the unique ways that the COVID-19 pandemic has impacted that dual pandemic of intimate partner violence, and then also what we're talking about in terms of race and ethnicity for the Pittsburgh region.
Yeah, absolutely. No, very happy to answer this question. I also wanted to just really say that I so resonate with what Dr. Chang and Dr. Jones were saying, particularly Dr. Jones, you were saying about how people will say, it's within the culture. And I think that culture is such a beautiful thing that should be rooted in strength and pride. We really need to stop weaponizing culture as a way to explain away racism. So I just wanted to agree with you, Dr. Jones. So in terms of COVID, Dr. Chang and I and many others, including Becca Garcia, who used to work at the Women's Center, was a co-investigator on this project where we were interviewing IPV advocates to really learn about what their experiences have been like during the pandemic. And one of the things that we did is we interviewed several IPV advocates from around the country who work at culturally affirming either programs or agencies. And one of the themes that was amplified the most by advocates was this sort of syndemic IPV, COVID, and then structural inequities, and the way that the COVID-19 pandemic, as so much of us know, kind of laid bare all of the so many pre-existing structural inequities in our country. And so I think, I can offer some examples from the study, and then also just from what I've seen and heard. I'm sure so many of you have seen and heard similar things, but there's an example that comes to mind from a IPV advocate who worked with immigrant survivors, who was talking about how immigrant survivors, particularly those living without documentation, were not given the same resources and supports that folks living with documentation were given. And so really thinking about, so that's one example. Another example was that I can remember from an advocate who works with Black trans survivors, about how so many of the resources for trans identifying survivors were shut down during the pandemic, and how the safe and supportive resources were not available. And I think that so much of what I was hearing, and I think what we all sort of know, is that it is certainly abusive partners were using the pandemic to assert power and control. There were a lot of examples, of course, of control, but it wasn't just the partners, it was the abusive policies and practices in our country that were also being used during the pandemic to cut off resources and services for survivors, as well as create unique challenges. I do want to say, because that is it's so important to say that, but it does, I'm sure, feel so deficits focused to this group. And so I do want to say one of the other themes that was deeply amplified by this work was the amount of community level resilience. And I just want to deeply thank all the IPV advocates for all of their work during the pandemic. You were frontline workers, you're an essential part of our healthcare system. And so much of what was discussed in this study was of the amazing work that IPV advocates were doing, adapting and supporting survivors, and the amount of community level resilience. I also just want to say, on the same kind of line as what I was talking about, was one of the other things that was brought up in this study is the deep need to continue prioritizing funding and resources for culturally affirming programs and services. That so many individuals talked about how they were, during the pandemic, their workload tripled or quadrupled because they were being asked. I remember a group organization that works with survivors who are living with disabilities were talking about how that they were being asked to do trainings constantly on top of supporting survivors without additional funding and resources. And so just thinking also about supporting culturally affirming agencies. So that is just a summary of kind of what was discussed, but really this idea of the oppressive policies and practices being abusive, during the pandemic was really heavily amplified by this work.
Thank you. Dr. Chang, please feel free to provide comments as well, because I know you've also been working in this area.
I definitely think that Dr. Ragavan gave a really wonderful sort of summary. The other thing too, I would just add is that, in terms of the being left out sort of kind of concept was also a theme. There's certainly already the biased and discriminatory sort of policies and practice, but there's also these blinders in terms of not recognizing that these particular service organizations or groups, or even the populations of citizens or non-citizens, the population people for whom we should all be caring for, should be helped as well. And so that sort of lack of inclusion was also a theme that sort of emerged that was powerful to me.
Thank you. So this question's for all of you. So get your answers ready. So echoing civil rights leader and rape survivor Fannie Lou Hamer's assertion that nobody's free until everybody's free, Molu is a domestic violence prevention educator with National Sexual Violence Resource Center, says that we won't ever end sexual violence without ending all forms of oppression. We won't ever end sexual violence without ending all forms of oppression. So for each one of you, how do you see anti-racism as central to our efforts to eliminate domestic violence? And we can start with you, Dr. Ragavan.
Sure. So yeah, it's such an amazing question. And I mean, I think it's fundamental. I just so fully agree with that. I mean, I think that the sort of structures and systems that are sort of rooted in racism, as well as xenophobia and language inequity and transphobia are, like I said, I think abusive to survivors. And I think without dismantling those systems, we will not be able to end the pandemic of domestic violence. I mean, I also think the other thing to think about is sort of this work on a global level as well, and sort of thinking about this, this work globally, and thinking about like systems of oppression globally as well. So, I mean, I just fully agree. I think that they are interlinked and intertwined, and that we, I think all of us are doing, really trying to work on dismantling both together. I also think that sort of there's I think so many solutions, but one of the solutions that I think is so important that I think both Dr. Jones and Chang mentioned is really sort of leveraging the wisdom of communities, and really sort of not being, and the wisdom of survivors, and really trying to be survivor centric in our work, because I think the answers will come from communities.
Thank you. Dr. Jones, jump in here.
Sure. I absolutely agree with all of Dr. Ragavan's comments. It's essential. It's essential. It goes together. And that's why I could really appreciate this talk today, because oftentimes we parse it out, and you can't parse out women of color in DV. So, racism prevents people of color from seeking help. And so eliminating or reducing racism to just a blip can absolutely increase the amount of people of color that are coming forward. And what does that mean? Well, we're decreasing the amount of women that are being killed. We're decreasing domestic violence all around. And so that's just very important. I was talking to the American Academy of Pediatrics last week, and I'm talking to their physicians, and talking to them about building relationships. Here's another one of my theories. Trainings don't do it. Trainings don't decrease racism. Relationships do. And so we don't need another training. We don't need to keep talking about what we know that has been, in this country for hundreds of years. And what we need to do in order to eliminate racism is to build relationships. And how do we start with that? Well, speaking the same language, talking about what's important, talking about historical racism, talking about what connects us, what makes us different, and what makes us similar. So we always try to leave out what makes us different, which is not realistic. That's the cool part. What makes us different is the cool part. So, just eliminating or focusing on knocking down that barrier of racism then increases the likelihood that people of color are coming forward, are getting the help and the care that they need, and being empowered, to continue on themselves.
So we've heard of, having a global approach, being globally focused, but also being survivor centric. We learned in terms of this talk, understanding that they are connected. So why are we trying to disconnect them? We have to address both issues of trauma, and also looking at how we build relationships. Dr. Chang, what would your comment be related to the fact that we won't ever end sexual violence without ending all forms of oppression?
Like Dr. Jones and Dr. Ragavan, I definitely agree with that. And if everyone would indulge me the ability to kind of delve into my liberal arts background and sort of think philosophically, I think that there is that sort of core element of power dynamics. All of the isms to me seem to be sort of linked to the core dynamic around power dynamics at the identity level, right? This sort of perception that value, power, rights, happiness, somehow is a limited pie that isn't able to be shared, and that it's sort of a, there's a winner take all sort of mentality where there's, people who want to dominate, and in order to do so, the concept that it has to be at the expense of someone else, right? And I feel like that's a false sense of sort of identity and power dynamics with regard to a lot of these things that continues to haunt us in all these different facets of sexism, of racism, of the violence that's perpetrated in order to sort of sustain that type of belief and those power dynamics and those identity beliefs. And so I think until we begin to kind of realize that, just like what Fannie Lou Harmon said, and what we can see on some of those bumper stickers, we all do well when we all do well, right? That there is not sort of a limited supply of value and peace and happiness and power, that those are sort of concepts that are not actually in a limited space that then need to be sort of held on to at the expense of someone else. And so thank you for indulging my sort of waxing philosophically today, but that's sort of one of the thoughts that popped in my head.
Oh, thank you, Dr. Chang, for that, because as you talk about power, I noted that we kind of had a baseline level of, expectation of understanding coming into this talk, because there are those who, don't think about the various ways that power actually plays out. There are those who've said, well, I don't see the physical scars. Are you sure that you're being abused? We're past Jim Crow. Does racism still exist? Yes, racism still exists. And yes, there are other forms of abuse, that there's emotional, there's financial, there's spiritual, that there are many forms that we actually see playing out in intimate partner violence. But because of that, not like people just focusing on, what's physically evident and visible, that also serves as a barrier for some women coming forward for that and developing that relationship. So we're about to go into our last question. So I'm going to make sure all of you that are listening are able to put your questions into the chat. As you can see, we have, again, very knowledgeable panelists, but also passion. You heard them talk earlier, volunteering for internships and coming in and being involved, not only from where they were earlier in their careers, but still being involved today. So great wealth of expertise and information on this panel. So please put your questions in the chat. So for each one of you, we'll start with our initial order with Dr. Jones, then Dr. Chang. So if you can, and I won't chime in, so just jump in after the other person goes. Please provide one concrete action that we could do to better support survivors of color. What is one concrete action that we could do to better support survivors of color?
So I always have this joke telling a college professor they only can say one limited comment. It's like, we like to talk. We could go on all day. All right. I will contain myself. People who work for the public and work with people in the public have to be sensitized to historical and overlapping types of trauma that people of color have experienced for hundreds of years. So, we have to be cognizant, we have to be plugged in, and we have to be intentional in asking historical questions and asking specifically racial and oppressive questions, and eliciting and listening to those answers. Once we remove that layer, or once we expose that layer, then folks are going to talk to us. They're going to feel connected. They're going to share all of the above. But the biggest aspect of that is they're going to know that we care about them and that we believe them. If we say, I don't see color, and just gloss past it, that means you don't see me and I can't see you anymore after today. And that's what's going to continue to happen. And so I'm a big proponent for building relationships, but that's where it starts. Being sensitized about that historical, traumatic trauma background and being intentional about it, and then building a relationship, moving on from there. That's key to me.
Yeah, building off of what Dr. Jones said, and then also kind of circling back to, I guess, what my main focus had been, or, that type of remediation that I personally had gone through in terms of training with the Houston Area Women's Center. I guess I would say my main advice is to truly listen with humility and curiosity, in order to really make sure that we center that other person's experience, their sense of value, their sense of context, and we get a sense on sort of how we can assist them based on how they direct us. I think that sometimes, especially as physicians, we get into the perception that we know what's better or what's right. And I think that what we need to do is take a step back and recognize that we may not know, that we need to have some element of humility to ask what role we really should play and how we can help, and also where we've hurt, and then to take accountability for that.
Yeah, I totally agree with both of the suggestions, and also agree that it's really hard when someone asks you to just do one, but I'm going to try. So this is a very concrete action, but I think in your place of work or wherever you spend your time, to put up resources. And so I love the flyer that the Women's Center and Shelter created, that has both, all of their numbers plus the numbers of the partnering organizations. And I would recommend putting that up in English. And I know that there's one in Spanish and in other languages as well. And I think that creates an environment that where everybody knows that healing and resilience are prioritized, and where while disclosure is never needed, the resources are available. And I think just that simple action can help create an environment of healing, and make sure that everybody has the resources they need. So my suggestion would be to put up resources in the place where you spend the most time and the most work. That is, I'll limit it to one. It's hard, but I'll do that, and also say I totally agree with Dr. Jones and Dr. Chang as well.
Great, thank you all. So just to summarize what we've heard is, we heard expose that other layer. That means, you're asking those historical questions, and to understand that there is a larger context, and listening. So you ask the question, but then you also need to listen to that response. We also heard to take a step back, and that is that when we're listening with humility and curiosity, but at the same time centering the survivor and the survivor's context. And then the last thing we heard was thinking about our spaces. Where are those spaces that we are? So it's not just home, but there are other places as well. So in those places of work, that we will put up resources and making sure that those resources are inclusive and that they are accessible. I'm not a panelist, but I'm also going to put mine out there as well, that as we're better supporting women of color, is understanding that there can be a dual trauma that is happening here. And so coming through and getting to that place of how do we continue to support women of color with all the other isms. There's a group we haven't talked about. So for example, we haven't talked about children in this talk, and we know that they are factors. Women are more likely to be the primary, if not sole, breadwinner in their family, particularly for women of color. Some estimates have put that up to 80%. But then also understanding what that context means in terms of then decisions that someone is making, not just for herself, but also for her family. So I wanted to say thank you to all of our panelists. So any other parting comments that you would like to have like as we get ready to end out for this afternoon? Any parting comments from any of you? So this was your opportunity to slip something else in there when I restricted you. Great. Okay. Do we have any? Sorry, go ahead.
I just want to congratulate you all for bringing up this topic and making it a center of attention. That is part of, dispelling myths, reducing stigma, etc. That's what this kind of work here today is what's going to help people of color to come forward. So clap, clap, clap to y'all. Thank you so much for doing this.
Yeah.
Definitely. Go ahead, Ragavan.
No, Judy, go for it.
Well, definitely, I congratulate all of you, and I look forward to, I embrace sort of everyone's curiosity and passion around this, and I look forward to hopefully continuing to work on this, to really try to illuminate and understand, and really challenge ourselves to create sort of new systems or new approaches to really addressing these longstanding isms that I refuse to believe are just part of the way the world works, right? I do believe that we can actually have a different approach and that we can look at things in a different way. And I know it's going to be hard, but I'm willing to be part of that process. And I look forward to working on that with the rest of you.
Yeah, I agree. Thank you so much. This was such a privilege to be part of this. I agree that we need to continue having these conversations, continue being present in this movement, fighting in this movement. I also want to say, this is urgent but long work, and to take care of yourself and each other as you're working in this space.
Thank you. And I'll say this to Nicole, because Nicole is on this call. YWCA is committed to continuing our partnership together around these issues, because, as was stated very, very clearly, we can't separate. Like I'm not here separate from being a Black woman. I am a Black woman, right? So that's just part of who I am. So I think it's important for us, until racism is eliminated and until inter-partner violence is eliminated, we will continue to work together to address these issues. I want to say thank you so much again to all of our panelists. I know that the sponsors were thanked earlier on, but we want to thank our sponsors again. And I want to thank all of you. And I just want to say thank you to, there are a couple of my sisters who are on the call. Thank you so much for this. But for our panelists, you did an amazing job. Thank you for sharing your insights around these issues. Thank you for having us think about those tough questions that we have to ask ourselves in terms of where is our place in this, and what is our role? What do we do moving forward? We haven't mentioned them, but I do want to talk about our allies, our male allies, white allies, and accomplices in this work as we continue down this path. Also understanding that, as we've said, all gender identities are impacted by this. And I also want to say thank you so much to Women's Center and Shelter, to your staff for all that put this together, to our team over at YWCA Greater Pittsburgh that was involved in putting this together as we come to this continued partnership to actually create those safe spaces where people can heal. Finally, I'd like to remind everyone to register for our upcoming YWCA Greater Pittsburgh Action Conversation on Race. These are held the third Wednesday of every month from 12 to 1. The next one is coming up on Wednesday, November 17th, and it focuses on Black trans lives matter. And so this also is another topic related to gender-based violence and how we can be an effective ally. You can find the information for that on our website, ywcapgh.org. I know that there have been a lot of resources that have been populated in the chat, so we can so get those, but we can also make sure that those get out to you. Thank you, everyone. Again, have a great afternoon, and we're in the fight. So let's continue to lift up. I'm actually going to end on this comment, and Dr. Chang, you said this earlier. As we think of survivors, we're lifting up the power that's already within. Let's continue to lift each other up. Thank you.